Alive and Well STL is a presentation of the St. Louis Regional Health Commission and Rare Gem Productions to build a healthier St. Louis. Power up with the positive. Learn more at oneraregem.com. That's ONERAREGEM.com.
Support for Alive and Well STL comes from Beyond Housing, helps entire communities become better places to live. Learn more at beyondhousing.org.
The Regional Health Commission works in partnership with regional health sector advocates and stakeholders to improve healthcare access, reduce health disparities, and improve health outcomes for the uninsured and the underinsured in St. Louis City and County.
Alive and Well STL with Bethany Johnson-Javois, CEO of the St. Louis Integrated Health Network and Managing Director of the Ferguson Commission.
So when we think about our friends, our families, and neighbors, specifically those who have been diagnosed with HIV/AIDS, their path to alive and well can sometimes be a very difficult and challenging one. There are times when there's uphill battles and sometimes not. I know from the data and from talking with community members that African Americans in particular have been disproportionately affected by HIV/AIDS since the beginning of this epidemic, and that the disparity is growing deeper over time.
It continues to grow. Again, new diagnosis, highest rates among young African American men up to the age of 25. It's still one of the leading causes of death for African American men between the ages of 25 and 44. It impacts more African American women in our community as well as nationally than any other population of women in the area.
So for us, last year we tested 2,500 individuals. 4 were positive and 17 continued to receive healthcare services. We really want to do a better job. We are trying to include it for all of our patients to be tested when they enter the health center so that they can know their status and we can help them and direct them to resources.
We'll be right back.
Shh, quiet down, man. What they saying? What they talking about?
Yeah, not only does trauma and toxic stress affect us physically, it affects the choices we make and it affects the opportunities that we have. If I grew up in Spanish Lake, the opportunities and choices I would have would be much different from Afton and Sunset Hills. We need to keep in mind that communities under stress and under constant trauma, the choices and opportunities differ.
Oh, yo, you gotta be kidding me. All this time we've been thinking something was wrong with us, and everybody looking at us like we just turning up for nothing. No wonder cats is all wound up, worked up, and upset. It's mad stressful out here, and it's making us sick. It's time to thrive.
We have to recognize the true cause, the root of what's wrong with somebody. Working not to address the symptoms, but to address the cause. It's time to thrive. Be alive and well.
I think what's important is for us to be willing to understand what has happened to people. So instead of what's wrong with that girl, it's what happened to that girl.
Join this movement at aliveandwellstl.com.
So as you're aware, the title of this program is Alive and Well. And I first want to start before jumping in by asking you your definition of what does it mean to you personally to be alive and well in STL?
Well, I'll comment for me personally. It means that I am living the life that I vision, and I'm healthy in doing that. So I'm being who I am, and I'm healthy, and I can help other persons and mimic that and be a mentor.
And I would say very similar. It's about being a part of a community and being keeping that community healthy in so many ways.
That's great definitions. Thank you for sharing.
Alive and Well STL.
Greetings, St. Louis. Thank you for joining us today. I am Bethany Johnson-Javois, host of Alive and Well STL and Managing Director of the Ferguson Commission. Today we are joined in the studio by Angela Clabon, Chief Executive Officer of Myrtle Hilliard Davis Comprehensive Health Centers, and Dale Wrigley, Director of Engagement and Advocacy of St. Louis Effort for AIDS. Your work in helping and supporting individuals affected by HIV/AIDS in our community is instrumental as we become alive and well. We are eager to hear from you today, and I'm looking forward to speaking more on this topic. So welcome to the studio.
Thank you.
Thank you.
So when we think about our friends, our families, and neighbors, specifically those who have been diagnosed with HIV/AIDS, their path to alive and well can sometimes be a very difficult and challenging one. There are times when there's uphill battles and sometimes not. I know from the data and from talking with community members that African Americans in particular have been disproportionately affected by HIV/AIDS since the beginning of this epidemic, and that the disparity is growing deeper over time. Do you find that to be the case as well?
It continues to grow. New diagnosis, highest rates among young African American men up to the age of 25. It's still one of the leading causes of death for African American men between the ages of 25 and 44. It impacts more African American women in our community as well as nationally than any other population of women in the area.
And Dale, what is the timing of the diagnosis? When is it happening? Early in stages or later stages? What is that?
Yeah, it's very interesting. For it's really kind of racial. So for white men, it tends to be now a seroconversion later or in midlife, so in the 40s. But the most newly diagnosed cases are among young African American men between the ages of 18 and 26. And that rate continues to grow every year for probably the last 5 years.
And do you find that diagnosis is happening once individuals have full-blown AIDS, or are we able to diagnose earlier? What are the statistics on that?
Yeah, it varies each year just slightly, but not statistically significant. Because we are seeing people younger, we are seeing more people with HIV rather than AIDS diagnosis. However, African Americans get diagnosed much more often already at an AIDS diagnosis from having delayed at even getting tested.
Ms. Clabon, what is your reaction to the statistics and the data based on what you are seeing and hearing in your health center?
For me, it's a call to action for FQACs in our organization. November, Murder Hillier Davis, we partnered with St. Louis Efforts for AIDS in their AIDS awareness event for testing. The goal was 1,000 persons to be tested. And we learned a lot. We also put on an event in February for Black AIDS Day. And what we found out was that many of our patients within our community were impacted. As stated, young men are the population that's been tested and they are diagnosed. So for us, last year we tested 2,500 individuals. 4 were positive and 17 continued to receive healthcare services. We really want to do a better job. We are trying to include it for all of our patients to be tested when they enter the health center, so that they can know their status and we can help them and direct them to resources. Just for locally, the 5,600 persons that's living with HIV, African Americans is 5 times higher prevalence than Caucasian. Males make up 84% of the new cases, which is 5 times higher than females. And the young adults in our region make up 39% of the HIV cases. And primary is men having sex with men. But in this St. Louis area, for us in our health center, our male population is about 40% of the persons that visit the health centers. So, and the young men is closer to 80% of that population. So we have a lot of young men that we must reach out to. And it's so important for us in the North St. Louis community to reach out to the African American men within that age group, because so many of them seek services in our organization, and we really would like for them to be tested. It would help our community a great deal. These are persons who may be infected and don't know their status, and we're trying to make sure that they know their status. So since they're using health services, maybe for flu, other types of issues, but while they're there, we want to test them so that they can know their status and live longer lives and live a healthy and be alive and well. So that's the importance of that.
Angela, how are we making connections and reaching out to young men who typically may not just naturally come and engage with a health center on their own? How do we do that?
For us, we have partnered with other agencies, and Dr. Patel is part of an organization where they have street teams going out to clubs, going to Boys and Girls Clubs, the places where they are, and educating them about the services that are out there, and just talking about the impact of this disease on our community. And while we're out there, making sure that we have the ability to test. So the ability to test has improved. It's just a finger stick sometimes, and it's not so invasive. So persons can participate, and they can call back and text back for the results. So it really makes it user-friendly for persons. So that's how I would recommend that we reach out. It has been effective for us.
I'm hearing some innovative ways to engage outside of four walls of a center or a building. Mm-hmm. And are there any other methods that seem to be successful that are working?
Yeah, Angela is right on target. It is all about outreach and meeting people where they are. It may be that people are getting tested in their home, not by a home health test. That is another option. That's another tool in the toolbox if you want to purchase that test. But also, there may be options for people to come to your home and actually test you. But it's being out on the street. It's being in a mobile unit. St. Louis Effort for AIDS has a mobile unit. Many of the health centers have mobile units. And it's now offering that test when we're out in the field because it is easier, because it's a quick, rapid test. We can do a confirmatory blood draw, but we can wait on that too, but we can do those in the field. There are new test methods coming out all the time. There's a 1-minute test now. Mm-hmm. It is a blood draw, but it is a quick test and it can be run, and that's up and coming and stuff. And again, but it's really being out in the field and then also being available. So it's nights and weekends. It's not always just the 9 to 5. And it's, again, when I mentioned about making it a standard of care, if I walk into a clinic or if I walk into a doctor's office, whatever it is, wherever it is, or an emergency room, if I have some other issue, if as a standard of care we would test people, we would know more people's status, be able to get them into treatment, and move forward with that for their health.
Angela or Dale, either one of you, what is the stigma still associated for people who may or may not want to be tested? There seems to be a stigma to know your status. Does that still exist in the communities that we're seeing and serving?
Definitely. So again, there's a combination of things. There is fear of knowing, that knowing could be worse than not knowing. So I think that fear still exists. The stigma itself, the stigma is really related to how someone gets HIV and what that means, whether it's in the family, at church, or whatever that means to that community of people. And if people know, what will that do to me? And so that's one of the biggest stigmas. And then as a society, and this includes St. Louis as a whole, we have issues still around sex, sexuality, and sexual orientation. And if we can't address those within our own communities, within our relationships with families, then that makes it very difficult to decide to get tested about something that may tell me something else about my life.
So help me to do some myth busting for those that are listening to affect kind of the stigma that we're finding and seeing. Angela, from the health center end, what are some of the learnings and strategies that you will take moving forward that might help you to find more cases and get more people excited about and encouraged about actually knowing their status?
Well, integration helps with that. When our patients enter our facility, we test. They come in for primary care visits, and most individuals are not aware that they're being tested, and they receive their results confidentially, and they continue to come through the health center. So that removes the stigma. But as Dale stated, it is the stigma and the culture. Just to share just a little bit, in 97, I lost my husband to lung cancer, and in that year, 3 other close friends and family members passed away, and we all thought it was cancer, and they passed from AIDS. And the stigma from that, some of that still exists, but right now there are persons in the community who are living well, alive and well, because of the results. Persons are coming to the health centers. They're receiving services from organizations such as St. Louis Effort for AIDS. So I am so proud of the progress made so far.
That's exciting to hear. Dale, give us more examples of those that are living alive and well now.
So there's a lot of great programs out there. One of the biggest things medically now is back in the early days of HIV and AIDS, people were on 30 to 50 pills a day. Today, people can take 1 pill a day and actually manage that disease, almost making it chronic. People have lived for 30 years. I'll tell a brief story. We have several programs in the St. Louis region. The Linkage to Care program actually is a resource for health centers as well as agencies like ours where people, if they get diagnosed or if they know their status and don't know where to go, they can call that line and get connected to case management services. There's also in that program a Beacon program, which is a loss to care, people out of care. And we had a gentleman who was actually diagnosed 14 years ago, never went into care, ended up in the hospital, a local hospital, in the emergency room, was diagnosed with pneumonia, was treated and released, but continued to be treated for the pneumonia, but with the wrong medication. They didn't have an infectious disease doc, but the hospital caseworker actually referred them to the linkage line. They got connected to the Beacon Project, and that Beacon Project met with them, met with the family. The parents had come in because he was very ill and about to die. He wasn't able to make his follow-up appointment because he was so ill, but they were able to get to him, get him enrolled, get him back into the hospital, and get him on the right medication. And today, 6 months later, so his viral load, or his rate of infection in his body, was over 800,000 milliliters. And today, less than 6 months after that, he got into treatment, and his viral load is undetectable, and he is getting married this fall. So big, quick little story, but that's a local story. And that's the impact that if you're in treatment, if you do get a diagnosis, it's no longer a death sentence.
I'm making an interesting connection, especially as this is, for many that are Christian, Holy Week, and the gospel means the good news. And in some ways today, we are preaching the gospel of the good news of what can happen when the community comes together, not only for the individual that you talked about, but what's the good news for the family and the friends of a person who loves somebody that is living with HIV/AIDS. They get 30 plus more years. They get how many more memories? Is there any support for family members and friends as well in this process? Do you offer that, Ms. Clabon, or do you know those services, Dale?
Well, for us, the good news, which is why it's so important that we talk about this, health centers, as federally qualified health centers, we're there for the low income and the uninsured. And the cost of medication, we provide the medication free for those individuals, especially if they're low income. That's the good news. Go to your community health centers and receive those services. They're there for you all and not suffer. And we're a patient-centered medical home, so we're not there just for the patient. We're there for the entire family. So they can come as a family to a federally qualified health center and not just Myrtle Hill. There are 4 or 5 in the St. Louis area and receive those services as a team.
Outstanding. So before we go, I need to know more, Angela, about the National Black HIV/AIDS Awareness Day event that happened at Harris Stowe. There were tons of people. There was lots of energy going on. Say more about that.
First, let me thank Shirley Raff for coming. I was excited, but the event turned out very well. Almost at least 1,500 persons came out. Only 120 were tested, no positives. That's good news, no positive. But the issue was persons came out to know their status. They were excited. A lot of the organizations partnered. Individuals volunteered. They asked that we continue to do this. They were so happy to know that FQACs and health centers were taking a stand with this issue. And even to know that it was integrated and they didn't have to get their status in front of individuals. We just mixed it all together. So, you just walked around and you ate and you listened to music and young ladies perform, and it was exciting. So it's a big day for us. Next year, we really want to reach out to the men. As Dale stated, young men having sex with men is on the rise, and we really want to target that population. So we're trying to bring in some hip-hop artists so that they can come in and know their status in a more conservative way, and it's integrated, and we can help the community with that.
So in closing, is there any other nugget of hope that you want to share with our audience or encouragement that you want to provide in terms of us delivering more good news in the future, Dale or Angela?
I think treating testing as a standard of care, both from the medical provider as well as the individual. If you know your status, you have power to make changes in your life. And there are people, there are agencies, there are health centers that are out there to help you and to support whatever it is that your health issue is.
Absolutely. Angela?
I agree, but this is for every person. The grandmother, the grandfather, the aunt, the uncle, and the children. So everyone should know their status, our senior citizens and our parents. So that's the message for me. That's the good news. That's what we want to have happen.
We've got power to change. I think on that note, we'll close the show, but definitely stay open to the possibilities in the future. Thank you both so much for your work and your creativity. We're making a dent in St. Louis, and I'm happy to be with you in that effort. Thank you, everyone, for joining us for another episode of Alive and Well STL. We look forward to speaking with you again next week.
Alive and Well, STL.
We are grateful for your gift of time to this conversation. We encourage you to stay involved and get involved.
If you, your family, or your organization is interested in talking about how we better the well-being of the region, sign up for more information, join the conversation, log on to aliveandwellstl.com, and let's build a plan on how we can work together and improve our overall health and become alive and well. The Regional Health Commission with Chief Executive Officer Robert Friend Jr. committed to providing a detailed review of change over the past decade in 14 leading health indicators for the city and county of St. Louis. The first decade review of health status report, an update to building a healthier St. Louis. Discover the narrative, the data, and celebrate the progress already made to improve healthcare access and reduce health disparities in our region. Learn more at stlrhc.org. Alive and Well STL is another positive production of Rare Gem Productions. Thanks for listening.